once you kind of have a patient try an independent pharmacy that's run properly, it's tough to get them to switch. It really is.
Welcome to another exciting edition of Talking Retirement, and I can't be more excited for our next guest. A lot of people in the field of healthcare don't know how a pharmacist can be part of your healthcare team and the unique expertise they can bring to your health situation. So we're able to talk to a great local pharmacist in our area to talk about, why he chose to open a local pharmacy, all the different things a local pharmacy can do for you, and in general, how a pharmacist can be a part of your healthcare team to help you live a healthy and fulfilling life and retirement. So thank you guys for joining us on Talking Retirement. Again, this is episode 3 with our local pharmacist in charge, Dr. Sharif. Thank you so much for joining us. How are you?
I'm very good. Thank you so much for having me.
Yeah, of course. So I want to start real quick, Dr. Sharif, in terms of, why did you choose to be a pharmacist? How'd you get into this field? What drew you to the field?
Yeah, it was just a good opportunity for me to kind of play towards my strengths academically. It worked out, and then it's a good opportunity to be able to impact people's lives through healthcare in a different and a little bit more of a non-conventional way. But I was afforded the opportunity to shadow like a really good pharmacist when I was in college, so kind of helped with my ultimate determination in going to pharmacy school.
Nice. Yeah. And I know you said you get the opportunity to help people as a pharmacist day to day. What do you find is the value add to people's lives? I think a lot of people just go and pick up prescriptions, but what do pharmacists do behind the scenes to make sure that your health is in good condition?
Yeah, I mean, behind the scenes, obviously, we're just constantly monitoring, medication therapy and their regimens, and make sure there's no drug interactions or allergic side effects that they could have. And then the number one thing that we have is their accessibility. So, your local pharmacist is always accessible to you. You don't really need an appointment to go see him or talk to him or her. And that's just something that's unique in our position to be able to even, ask or answer any of your questions. So.
Awesome. Yeah. Always appreciate that. I know it can be tough sometimes to get a hold of a doctor or, someone at a big chain pharmacy. And that kind of segues me into the next thing. As a pharmacist, I'm sure you could have worked for a big national chain pharmacy. What was it to you and your business partners? Why did you guys choose to stay independent and open up a local pharmacy?
Yeah, I mean, I did in the past. And it's just, for me, I felt that my services would be better put at use as an independent, and allows me to focus on what I think is more important, which is the patient's healthcare and their medication management, instead of just being bogged down by corporate numbers and quotas and whatnot. So it always made sense for me.
Awesome. That's great to hear. And obviously, we don't have to name names of the national pharmacies you worked for in the past, but I know you alluded to a couple things in the previous answer. What are some of the issues when you were working in the belly of the beast of the corporate pharmaceutical system as a pharmacist? What were some of the things that really drew you away from it? Was it just, you said, like a lot of corporate involvement?
Yeah, I mean, I don't think having a corporate structure in any healthcare facility is never really the best. And unfortunately, you're starting to see that a lot with hospitals and pharmacies, and even some doctors' offices become consumed by corporations. But you start becoming a little bit more business minded than healthcare minded, and the focus starts to shift more so on metrics and numbers, and it becomes hard to be able to service patients on the individual level when that's your primary focus. Plus, for pharmacies specifically, I mean, all of them, you don't have to name names, but they all have suffered with really bad understaffing. So that's become a big issue, and now it's become a big hot topic too, understaffing. And you have stores that are closing down or not even opening up for the day because they don't even have a pharmacist to work it. So that's been a big problem. Not enough techs, not enough pharmacy associates. So it's creating I would say, even an unsafe environment for the patient.
Yeah, I agree. I know a couple of the chain pharmacies in our area. Our offices are obviously in the same plaza, but I talked to people who said that, like you said, they can't get their drugs, or they show up and they're like, we're taking a 3-hour break because we couldn't staff these particular hours. Do you think that's just due to corporations looking for short-term profits and kind of prioritizing that over the long-term focus of the healthcare of their, customers?
Yeah, I mean, it's definitely a profit driven entity. And a lot of the staffing issues have to do with non-competitive pay and a lack of benefits and things like that for entry-level employees. So there's really not a lot of incentives for people to take on those jobs. It's tough, and then it's a revolving door. So, and they really don't do a good job of helping out the pharmacists or the techs that have been there for an extended period of time. If anything, you'll get like seasonal help, seasonal hours, and then they cut budgets. So then you're forced to let go of people. So yeah, it's tough to keep people there long term.
I didn't realize that they're doing seasonal work for a farm tech. That doesn't
Yeah,
sound like something that
seasonal
should be
work
even like legal. That's nuts.
during flu season. Everybody gets busier, so they'll add on some seasonal hours for you basically, and a lot of people will be hired under the expectation that it's a full-time thing, and then once that season's over, they'll drastically cut their hours, kind of forcing you to basically move on yourself anyway. So
So they kind of don't necessarily fire you, but they just say they've,
hours, or if you want to do your hours, you're going to have to bounce between the whole 30 stores in the whole district just to scrum up your hours, and it becomes way tougher than what you signed up for.
yeah, that's nuts. I didn't realize. I've obviously heard stories. I didn't realize it was that intense. So it's good to hear from someone who's on the inside to see what's actually happened. And since you guys have created CureRX, how are you able to change the system for your own company and your own business? What were some of the changes you wanted that you saw in these pharmaceuticals that you then switched into your own business that you're able to fix?
I mean, I can't think of a lot of specifics other than just staying true to our values as a pharmacy. Patient care and customer service comes before everything else. So just taking the time to sit there and seeing what that patient's need is our ultimate goal. So I feel like if you just keep that in mind, essentially everything else should fall into place.
Yeah. And have you found people gravitate to your more holistic, needs-based view once they get you, they say this is so much better than what I was dealing with, that it passes on?
That's some people even have an incentive to, let's say, use another Walgreens or CVS, and their insurance will incentivize them by having lower copays over there, but they'll decide to stay here and pay a slightly higher copay just because they feel like it's a safer place for them to get their prescriptions filled, and they develop a personal relationship between us and your pharmacist or your pharmacy staff. So I always say, once you kind of have a patient try an independent pharmacy that's run properly, it's tough to get them to switch. It really is.
Yeah, I agree. And I think we obviously have a lot of respect for you guys, and we have a lot of clients who say, oh, we don't want to deal with this chain, and we always like to send them to you guys. I know you mentioned the copays are a little bit higher with you guys. Why exactly is that? Why is something like a torvastatin, which is $0 on certain plans at a national pharmacy, suddenly $3 or $5 with you? Why is
so
that?
It depends. It could be the opposite too. Sometimes it could be cheaper for us than a national brand. That just has to do with contracts that PBM's put in place with different pharmacies. Now, obviously, the larger pharmacies are going to be able to encompass larger contracts. But somebody like me who's one independent, we joined something called like a PSAO, which is a pharmacy service and shared buying groups, which gives us like strength in numbers. So then we're able to go there collectively and get our contracted rates negotiated. But that's what it comes down to. It's just unfortunately, a lot of these big corporate pharmacies, they're double dipping. They not only own a pharmacy, they also own an insurance company. So they're able to incentivize a patient who has their insurance to have to use their pharmacy, which is something that is not regulated well enough. And there's been a cry out for that to be looked at, because if you look at it, it's causing like a monopoly system, really. But yeah, so that's really like the root of it all.
Yeah, I know in our experience, obviously, a lot of insurance companies, like you said, buy pharmacies. They also buy hospitals, and it becomes this vertical integration where they own every piece of it, and they say you have to use our people for the entire thing. But it's good to hear that you guys are able to collectively, as an independent group, almost act like your own separate corporation, but it's not just you, Dr. Sharif, going to these trying to get the same deals. You're able to work with other people. How does a group like that form? I mean, are you guys able to just meet together and kind of talk about the same problems and keep your independence by staying
Well,
together, which is kind of a catch
it's one of
22?
those things where you usually have to be introduced to one. Usually it's through your wholesaler or some type of buyer, and you want to pick one that kind of aligns with what you're looking for exactly. And again, they really just focus on the back end of contracts and networking, and not all of them are like that. There are going to be some insurances, a PBM, that you have to do that individually, but it will give you options to be able to take a big chunk of PBMs and automatically be contracted with them and automatically be preferred pharmacies for certain, insurance carriers, whatnot. So depending on your demographic and where you are, you want to do your research and figure out which one's the best one for you.
That's great to hear. And I know something we can tell from experience is when we look up numbers on Medicare.gov, and obviously you see a national chain pharmacy, it's usually a lot less, but we'll plug in you guys or another local pharmacy, and I find the quotes are usually off by many multiples. What I know from you is a $3 copay is listed as $20 on Medicare.gov. Do you find that a lot of people just don't realize that they can get similar pricing if they just walk in and talk to you guys?
Yeah, for sure. We do a good job of trying to, match those prices if it's going to retain a patient or a customer. So, you're at a disadvantage because people are instantly trying to go onto Medicare.gov or GoodRx and try to find prices. And, our independent pharmacies, they're not going to show up like that. So the best thing to do is just go in and talk to them and see what they could do for you. And like I said, it's an independent, so they want your business, so they're going to do whatever they can to retain you. So usually it works out.
Yeah, I've been shell shocked because a lot of times I've quoted people, like I said, $20 copays, and they go, "Ken, I went to the guy and it was cheaper than what it was Medicare offered or something." They're like, "We'll give it to you for $4 or whatever
just
it is."
Bypass the insurance. We don't even have to worry about putting it through the insurance, and just a cash price that we both agree on that's fair. And usually it just works out.
So we talked about insurance pricing. We talked about, this kind of vertical integration, this monopoly stuff that's been happening within healthcare. What are some other issues that you guys find you face in terms of trying to compete with, other healthcare systems and institutes and that kind of thing?
I would say, in terms of competing, obviously you're not going to be able to market as well and always stay on the cutting edge of technology that the big corporations are going to have. But the challenges that we face, they're going to be similar to corporate challenges. So, for example, like DIR fees is a huge challenge. And actually, there was just something that was implemented that supposedly, I believe, at some point this year, DIR fees should be more transparent. So, in case you're not aware of what DIR fees, so basically, when you process any claim through for a prescription, on your screen, it shows you what you should be getting reimbursed from the insurance and it's what the copay is for the patient. So you have an idea of exactly how much you're getting paid for that. And the DIR fee just comes on the back end before you actually get reimbursed. They'll just take a piece out of it. And there really doesn't have to be a rhyme or a reason. And I mean, you could read all the fine print, which is like thousands of pages long, but they basically enable themselves to take a little clawback and give you less than what you anticipated. So it becomes hard to keep up, when you're getting less than what you anticipate. So that's always the number one challenge for all pharmacies. Obviously, independent pharmacies more than others because, you're working with a much smaller budget. But apparently that's something that should be changing soon where right away on your screen, if there is a DIR fee, it should be shown right then and there, which is great. It'll allow you to be able to anticipate and predict what's coming in. But it hasn't been done now, and that's been a problem that all pharmacies have been fighting for years now.
Yeah, I mean, I think there's just a total lack of transparency in terms of pricing across the entire healthcare sector. I see people who get hospital bills, and it just says like general fee, and it's $1,000, and there's no reason for it. It just says that's what it is. So I didn't realize you guys were going through that too. Believe it or not, once upon a time, I was a pharmacy major in college, and I have a lot of friends who have since become pharmacists. And they talk about how when they're at a hospital or, all these different situations, a pharmacist is now really a part of a more holistic healthcare team. It's not a general practitioner, really carrying the team and doing all the work. So how do you find a pharmacist can be a part of your not generic, but your general healthcare team? I think a lot of people have just pushed towards physicians for a while, but what do you offer to add to that value?
Yeah, I mean, the thought process on that it should always be a team. So obviously, when you're inside of a hospital, it's a little bit more of a one-on-one team. So you'll have daily meetings with a provider, a pharmacist, the nursing, the social worker. Everybody will come together to look at your plan, uh, and what they can do to get you better and get you discharged. And everybody has something to contribute. On an outpatient level like this, it's a little bit trickier because you're not getting the one-on-one interaction. You don't have these close relationships with every single provider in the area, but it just has to have open communication. So, the providers, they're going to be the experts at diagnostics, and then your pharmacy is going to be, your expert at medication therapy management. So, just being the link between the patient and their multiple doctors is one of the most important things. So, you know, Mrs. Smith goes to her cardiologist. She's on this blood pressure medication. He says you have to be on this no matter what. It's important for your health. And then she goes to the nephrologist, and the nephrologist says you can't be on this because of your kidneys. You have to stay off it. And the patient is stuck in the middle. So then that's a good opportunity for the pharmacist to come and to kind of intervene and to be the link between both and maybe offer a better solution or a better medication that'll suffice for both of them. Because a lot of times there's a lack of communication between all the different specialists that the patient goes to. So that's a very important thing that the pharmacy does.
Yeah, it's awesome. It's not even something I would think about. If you have, one drug that doesn't interact with another, you might say, okay, both doctors don't know, they're kind of siloed away, that there could be a dangerous interaction until they get to you. And then that situation changes.
People assume that all their doctors are always informed on what's going on, but sometimes the information can get there too late. You can go to a primary doctor and they can initiate you on a medication, and they're supposed to inform all your other doctors of what's going on, but that information can get there a little too late, or by the time your other doctor takes a look at it, you could have been on this medication for a week or two. So that's where the pharmacist comes in and just makes sure that there's nothing that's going to harm you at the end of the day. And if there is, stop it, don't initiate it, and just counsel the patient, counsel the doctor, and just be part of that team.
Yeah, no, it's great to hear, and it's good to hear that there's safeguards in place in case something like that happens. So definitely appreciate that and can see it. Something I wanted to ask you guys about is I feel like there's in the past 3 to 5 years kind of been this anti-prescription, anti-pharmaceutical movement online, and it's kind of frustrating to see. Obviously, I think there is something to be said about healthy lifestyle and all those things, but what do you say to somebody who's like, I'm never going to take a prescription, it doesn't work, blah blah blah? Like, how do you deal with something like that?
Even as a pharmacist, I'm the type of person personally who believes that pharmacological intervention should be left as a last line of defense. So I'm always up for any type of holistic intervention, lifestyle modifications that a patient can take upon themselves that hopefully will help or prevent any type of disease state or better their life. But there are certain things where pharmacological intervention is necessary. It's life-saving. And there's been a lot of flack with that. But, for the most part, these medications are made, and as long as they're used for their intended purposes, they pass a very rigorous set of testing, years of trials and testing to make sure that not only they're effective, but they're safe. So, patients have a responsibility to take the medications properly, but so do providers and pharmacists and patient education. So as long as everybody's doing their part, I would say you should not be afraid of synthetic pharmaceuticals. You should just be educated on what you're taking and how to take it properly and ask questions. Always ask questions.
Yeah, absolutely. I think that's a great way to look at it. And I appreciate that you say you also incorporate holistic and lifestyle changes as well, because I think a straw man argument a lot of those people make is a doctor will never tell you to eat healthy or walk or anything like that. It's built into the expertise and advice you give, right?
Changing now. Even the way healthcare is being taught, new practitioners and pharmacists and providers, in school, the non-pharmacological interventions and lifestyle modifications are taught with equal value to pharmacological interventions. So it has to do a lot with pharmacy or healthcare being looked at as a a team effort. So nutritionists and dietitians and physical therapists, all those have an equal part uh, at the table.
Yeah, it's great to hear. And it's cool to see that there's changes happening with that too. So the podcast is called Talking Retirement. Obviously we focus a lot on seniors, and I'm sure you guys focus on seniors a lot too. In your mind, when people are hitting that 55, 60, 65 mark, they're about to enter their retired life. What are some things you should tell people to look out for in terms of warning signs that their health may be declining, or how do they stay healthy as those years happen, as they start to age and get a little bit older?
I think it's all about prevention. So preventative measures are going to be the way to go. Try to be proactive about everything. So there's certain screenings that you should be getting at certain ages. For example, after 50, males should be getting, prostate exams every 5 years and colonoscopies routinely. Things like that some people will put off are pretty important because, it's very easy to treat something when you catch it early. And it's even easier if you're preventing it. So, yeah, stay on top of your own health. Make it a priority to go to your doctor's office and do anything you can do to be proactive. Whether that's if you have no type of exercise incorporated in your life, start exercising. Doesn't have to be something crazy. Mildly going for walks, and just obviously make sure that your diet is well rounded and a healthy diet. Those two alone could help prevent a lot of those disease states that seem to be very mundane, but very dangerous, like diabetes and blood pressure and cholesterol, which usually once you get one, it's like a trifecta. You develop all three. So that kind of leads into worse situations.
So catching things early or just stopping them from happening entirely is the better way to go about things in a lot of cases.
Absolutely. Understanding also your family history, genetics, that's also very important. So if you have obviously a large family history of cardiovascular disease and heart disease, then that's something that you want to pay more attention to, and so on and so forth.
Absolutely. So I think something that makes headlines and obviously a lot of people go through is just the cost of prescriptions and, why they're so expensive, particularly these specialty medications that you see on TV or make the news. Why exactly do these prescriptions come out so expensive? Like, why is something like Kesimpta $90,000 a year or something like that?
Well, there's two answers to that question. One, because when you have a proprietary item and it's a brand name, you're the only person that makes it. So you can kind of set your price what you want it to. And obviously, the more something becomes obsolete, the more expensive it's going to become. So supply and demand is one thing. The other problem is one can argue that it is too rigorous of a clinical trial. For on average, it takes about there's a study that is out there. It takes about $1 billion to put out a new medication. And from the moment that you apply for a new drug application, that's when your patent starts. Usually your patent is given to you at a maximum of 20 years. So from the moment you apply for that new drug application to the moment it's on the market, now we're talking about submitting the IND, so going to 3 phases of trials and then clinical trials, takes about 10 to 13 years. So that cuts into at least half, leaving you maybe 7 years of that medication to be your proprietary medication on the market, and you spent $1 billion on it. So from a business standpoint, these pharmaceutical companies are putting things out to make money. So right away, they're going to be expensive because they're trying to make money back and they're trying to become profitable. After the 20-year span, they could apply for an extension in the patent, but that's no guarantee that they're going to get it. So once the patent's over, generic companies are free to basically put that same medication on the market, but they don't have to go through the same rigorous clinical trials that takes 10 to 13 years. All they have to do is submit evidence of a basically equivalence. So they just have to show that this medication that they produced is pharmacologically equivalent to the brand name. That can take a max of 6 months. So company A spent 13 years making it, company B spent 6 months copying it, and they're both going to have it on the market. So one could argue that the clinical trials are a little bit too long, and it's not fair for the first company who's making it to only have such a short patent, or at least extend it to when they actually get it on the market, their patent should start. And hopefully that would cut down on the cost of these brand name medications. But other than that, we have very little oversight. I mean, it is a private sector thing, and they get to set their own prices. But yeah, I think the patent situation is one of the biggest reasons why brand names are so expensive when they come out.
Gotcha. Do you think maybe if these generic prescriptions, if they were giving maybe a royalty fee or something to the brand name, it might help alleviate it or something like that?
You know, it's not a bad idea. Never thought about something like that. Something to consider, but then you have to look into, you know, what's a fair amount? Is it a percentage? How long do you pay the royalty fee? You know, there's a lot of intricate things that you'd have to work through, and that may be a good answer as part of a couple of things that you can do to alleviate these drug costs. But something definitely has to be done, because the problem is these brand name medications are so expensive, and every single insurance has their own different formularies. And these manufacturers are aware that a lot of patients will have high copays or it won't be covered at all. So they offer all these assistant programs, copay savings cards, or even free trials. But then you run into a situation where if you're over 65 and if you're on Medicare, or even if you're under 65, you're on any type of federal insurance, you can't qualify for like copays assistance, which that's something that I feel like as a country, lawmakers are really dropping the ball on, because most of the people who need these medications are people who are over 65 on Medicare and on federal insurances. So they can't even benefit from manufacturer-backed rebates or coupons and discounts. So that needs to be, you know, fixed as well.
I agree. I know from our experience, when people get on Medicare, the thresholds in many cases for copay cards, state assistance, all these things that are really life-saving programs, suddenly the thresholds jump to such a high level that unless you're really, really making a lot of money, you know, or like in very, very extreme poverty, you're not going to be able to get into these programs. So it's like, okay, you're right above the threshold, but now all your money is going to this prescription. So you're back in poverty again. You know?
Might as well stay in poverty and then have qualify for all these assistance programs, which is a bad way to think, but that's just the way the system is set up. So yeah, things definitely need to change.
Absolutely. So I got two more questions for you. I know you probably got to get back to work. One thing I want to talk about is there's been a lot of new players in the space of pharmaceuticals and pharmacies. You know, we have Amazon RX Pass, they have PillPack, the place they bought. We also have Mark Cuban entering with Cost Plus Pharmacy. What do you think of these new companies that are not necessarily in the pharmacy field jumping into the pharmacy field to help sell, in many cases, generic prescriptions? What do you think about that?
It's a big enough industry, big enough market. There's enough space and room for everybody. I would just say be cautious on what's being promised and all the information out there. A lot of times, what they try to sell as these exclusive deals are available to you at your local pharmacy too. There's really nothing special out there. They're just using their branding and their names to try to make it seem more special than it is. There's going to be a demographic that likes doing that. There's going to be a demographic that wants to just have, you know, go online and upload prescriptions and get it shipped. And there's going to be a demographic that me and you are familiar with that's not going to work, and they need the the one-on-one service, and they need to be able to pick up the phone and call somebody. So again, it's a big space that could fit everybody, but I'm not too worried about one person demanding it or commanding it at all.
Yeah, and I think it's funny that you say that, because I think there's been a lot of PR behind those campaigns where they say, oh, they're changing and making prescriptions affordable for everybody. Right. Then you look it up and it's all generic drugs that are cheap anyway. Like the one website I looked it up, it was like atorvastatin's usually $40 a month, but here it's $2. And I'm like, atorvastatin costs no money. Like
if somebody had a $2 copay on some atorvastatin, I would be fine with it. Listen, generics are not your moneymakers in general when it comes to pharmacy. For the most part, they're not. Some of them are, some of them are not. But that's not what's raising the overall healthcare dollar. And those are not the medications that are unaffordable to patients in general. It's the brand names, it's the injectables, it's the biologics that they need that are, you know, they're constantly getting hit with you know, deductibles or being out of network, so they're having high tier copays, things like that.
Absolutely. So I got one more general question for you. I really appreciate your time. What are we talked obviously about a bunch of different problems and solutions. What are some, you know, 1, 2, 3 big bullet points you'd like to see change within your industry?
Yeah, so I actually think the extension of the patent on brand name drugs would be one of the best things, because if a pharmaceutical company has that extension and has a little bit more, breathing room to recuperate and make a profit, they should be able, in good faith, to lower the cost of brand name drugs. I wouldn't even be upset if they did that, with the added benefit of having some type of federal oversight in limiting how much these brand name medications can cost. But again, make it fair. Give them more time to recuperate how much they expended. So that's number one. I think there needs to be also a little bit more of a mandatory or oversight, some piece of your R&D as a pharmaceutical company to be put towards antibiotics, antimicrobial stewardship. So we have a problem with like gram-negative antibiotics, where we've developed such a resistance to them that people are unfortunately losing their lives from common bacterial infections. And if you think about the logic we said, spending $1 billion as a pharmaceutical company to put out an antibiotic that somebody may only be on for 7 to 10 days, where's your profit margin? So you don't have an incentive to do that. Most pharmaceutical companies are going to spend most of their research and development on long-term maintenance medications that are not so much going to treat you, but just keep you alive and keep you going, right? That's where their money is. You're going to be on that medication for the rest of your life. So I wish we focused a little bit more on that. And lastly, I think just less of the corporations buying other corporations and monopolizing healthcare. That would be probably the last bullet point.
Yeah, that's all great points. And I really appreciate your insight and experience. And I had no idea that the antibiotic resistance was already happening. I'd read articles where they say, oh, in 20, 30 years, it's going to be the case. I didn't realize it was already happening. So that's pretty crazy.
For a while, yeah.
Yeah. All right. Well, Dr. Sharif, thank you so much for your time. Always appreciate it. If anyone wants to reach out to you, I will link all your information in the comments. But just so you know, CureRX, located in 600 Mule Road, great local pharmacy in Toms River. So thank you very much.
Ken.
Thanks again for tuning in to Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we will see you in the next episode.